In the first two panels, we'll take a deep dive into the two key enablers that allow various stakeholders in the health to work more effectively together. In the first panel, we'll talk about partnerships. How can leaders from different organizations and work within their own missions to come together to solve common goals in health equity? After a short break, we'll come back for the second panel, where the key theme is trust. In my upcoming book, we discuss the need for our industry to rebalance efforts between the business of healthcare and the social good of healthcare. I'm excited to hear from our panelists on how they view trust as the key enabler to improve the impact of altruistic behaviors from the private sector. Later today, we'll have 3 panels on the barriers to achieving better health for all. Right before lunch, we'll learn about how technology is changing healthcare delivery. This group will discuss not only how technology changes access, but also how digital tools also change what interventions people receive. After lunch, we'll close out with conversations on 2 more barriers. The first will focus on the last mile to healthcare. In other words, how can supply chains change to create greater access while remaining sustainable? And in our last panel, we'll dive into the topic of financing. This group will discuss value-based care, improving access while not drastically increasing payer costs, and the impact of new technology for financing. So, everyone at home, been listening for a little while, stand up for a minute, take a quick stretch, get those legs moving, and while you do that, I'd like to welcome our first panel up to the stage. This group, led by Robert Kruit, will focus on partnering for health, building strategic partnerships to achieve the goals for access and equity. If you have any questions for our panelists, please feel free to submit them using the Q&A button on the bottom of your screen. And our moderator will do their best to address these questions at the end of this session and every session afterwards. I will now hand the floor to Robert Kruit, Executive Vice President, Business Development and Strategic Partnerships at Zuellig Pharma.
Good morning, everybody. Welcome to the second session, Partnering for Health, Building Strategic Partnerships to Achieve the Goals for Access and Equity. I've got a great panel with me today. Ada Pang, who is the Public Affairs Lead for Sanofi in APAC. And prior to that, she has led the Friesland Campina Public Affairs practice as well. And I think two of your more recent endeavors have centered around the vaccine confidence framework with Lee Kuan Yew University, as well as UHC 2.0, which was a white paper done together with the WF and Sanofi. So very interesting. Second panelist, Giles Newmarch. Giles is a Senior Investment Officer focused on health and education at the IFC, International Finance Corporation, and part of the World Bank. And Giles has held many corporate development leadership roles in Australia and in, for example, McKesson, Medibank, and Primary Healthcare Australia. And online, we also have Ewan Davis. Ewan is a partner at Quadria Capital. Quadria is a healthcare-focused private equity firm, and Ewan looks after the Southeast Asia portfolio, which includes very important infrastructure assets such as FV Hospital in Vietnam, Hermina Hospitals in Indonesia, and Royal Healthcare in Singapore. So today we'll be talking about partnerships and how partnerships can contribute to improve access and equity in healthcare. And right now, public healthcare systems do not provide widespread access to innovative therapies across the region. There are many reasons for that. Probably the most notable barriers are financial barriers, regulatory barriers, as well as infrastructure barriers. And as a consequence, and due to the limited resources, many of the UHC systems actually focus their resources on genericized products, treatments, really on volume, and not necessarily on the more innovative side of the business. Now, that also means that the private sector and other parties need to help cover the gaps that exist. These partnerships that exist because of that very often appear to have a philanthropic character, but actually when you look a little bit deeper, very often there's a win-win situation there for everybody involved, be it public, be it private sector, be it institutions. One key example is in India, where the Co-Win portal, which is a private-public technology portal, actually to date has 950 million users and has helped administer over 1.6 billion COVID vaccines. So let's move to the panel and let's discuss a bit more. And maybe we start with a general question on how we think public-private partnerships can actually help improve access to innovative therapies. And it's very easy, of course, to take the COVID pandemic as a starting point. Giles, when we look at how fast vaccines for COVID arrived in Asia, it was quite a while after they became available in the EU and in the US. And I believe that has triggered discussions around whether reliance on few global suppliers is actually the right way, or there should be more of a region-centric focus when it comes to vaccine security.
Yeah, and I think, and maybe to kind of set some context to that, and I think a lot of this is well publicized, but when you're looking at kind of the vaccine rollout during COVID, I think it was very clear that there was an inequality of access, especially in the early stages of the pandemic, and predominantly a lot of the manufacturing and the kind of more advanced technology platforms were based in Europe or the US. And that in itself meant that it took time for Asia and really, and even longer in Southeast Asia to have access to those vaccines. So that was one challenge. The other was the supply chain, global supply chain, the value chain of vaccines. As we all know, and I think we'll touch on this a little bit now, it's a very complex value chain with many different components. And I think during COVID, because of the lockdowns, the supply chains were found wanting. And again, kind of probably more amplified in Asia and Southeast Asia, again, due to its fragmented nature of the various countries in the region here. So that kind of sets the scene of the challenges. So where we saw an opportunity to really address these, and we've been working with, IFC's been working with the World Bank and ASEAN on looking at what vaccine security looks like and where the main challenges are. So doing a baselining activity, understanding the kind of the lay of the land, and then what vaccine security looks like in 10 years' time. It's highly complex. You have to have many different stakeholders to make it work. So you have to look at the regulatory environment. You have to look at the government agencies that are involved in the various different countries. You have to look at the financing of vaccines. Then you have the supply chain. So you have the private sector and public sector actors in that. So because it requires so much convening, so many different stakeholders to be on the same page, that was a big challenge. And I think that in itself has actually generated quite a lot of momentum coming into the region now. There are various different forums that are starting to be set up to help overcome a lot of these challenges that have been identified and hopefully try and provide some vaccine security going forward. I think when you're looking at it as a region, we have China and India as very big markets, big manufacturing markets, and good technology capability, and their technology platforms have really evolved very quickly over the last couple of years. And then you have Southeast Asia, which have fragmented markets. So where we're looking at is how do we make sure that we can develop vaccine security within the region and identify where there are hubs of capability and which countries should be doing what in this whole kind of value chain.
Great. So let's hope we don't need it for next pandemic, but it's good to know that we're getting more ready in the region. Now, access very often is impeded by because of financial barriers, right, Ada? And I mean, coming or working with a manufacturer, very often manufacturers help alleviate that financial burden, but they also help shift the focus, right, from treatment to prevention. So what are your views on that?
Yeah. Thanks, Robert. I think like COVID-19 pandemic has just worsened the underlying or existing challenge of the healthcare system. And on top of that, you have long issues about aging society and growing chronic and communicable diseases. This is why I think preventive care is getting more important, how to further prioritize the preventive care. And preventive care is more cost effective. But if you take a look about this part of the world, most governments spend less than 10% of total healthcare budget on preventive care. If I take vaccine as example, there's many studies to demonstrate the cost effectiveness of vaccine or life course immunization. And there's one particular study for low and middle income countries. If you spend $1 on vaccination, you can save the country $44. I think demonstrate that how can government to have better investment on prevention, including immunization. And related to the earlier point I mentioned is, apart from vaccine supply or security, it's how to do the access part. Before COVID-19, most countries in this part of the world, they never done elder vaccination. How to educate elderly about the vaccinations concept, where to get the vaccination. There's so much can be done. That's a hopefully COVID-19 pandemic, we all learn something new and to take it forward before the next pandemic to come.
Thank you. You and Quadria is very active, right, in the healthcare environment with investments, a lot of investments in hospital infrastructure, diagnostics, laboratories. How are some, and also in light of ESG, right, which is becoming more important for investors and private equity firms, how are some of your portfolio companies contributing to improving access and equitable access to healthcare in the countries that you operate in?
Thanks, Robert, and good morning, everyone, and thanks for having me with you today. And before I answer that great question, just a very quick moment of context for the audience. As you mentioned, Quadria is a private equity company. Unlike general funds, we invest only in healthcare and right across Asia, and we currently manage more than about $2.5 billion in assets under management, and we've worked with more than 20 leading healthcare businesses in Asia. And when you talk about investing in healthcare, to us, that's investing in quite a wide range of healthcare businesses. So everything from hospitals to primary clinics to healthcare at home to telemedicine to health tech to pharma and medical device contract manufacturing, and then extending even into consumer health and retail type businesses. So a very broad range. But our mission is very simple. We are for profit, so we are investing in order to generate good returns for our investors, but at the same time making sure that we are benefiting the greater good of regional development of healthcare. And as you mentioned, we are an impact and ESG focused investor. And to provide context around that, because impact and ESG can mean lots of different things to lots of different people. Our impact framework is focused on 4 fundamental pillars of providing greater access, affordability, awareness, and quality healthcare. And we seek to advance each of those 4 objectives in the investments that we do. To answer your question, practically, how are we trying to help solve for access? I mean, again, bear in mind, in Asia, the access problem is stark. It's estimated that approximately 1 billion people in Asia will never see a doctor in their lifetime, which is, of course, a tragedy. And access to healthcare is a fundamental human right. So what can a small healthcare investor like Quadria do to help in terms of providing access? So we like to invest with large, scalable businesses that can really address as broad a patient universe as possible. So as an example, we really believe in the business model of Hermina hospitals in Indonesia. They serve close to, well, in excess of 5 million patients a year in the country, the vast majority of which are covered under the Universal Healthcare Coverage Program, the JKN in Indonesia. They are the largest provider of healthcare services to that covered population. And so we invest with them to help them grow more beds. We're helping them develop greater clinical breadth and depth so they can provide care to an ever larger number of people for an ever larger number of needs. Another important issue in terms of access is access to specialty care. I know a lot of the focus of this panel is about the power of partnership. And so, for example, in places like Vietnam and Indonesia, where there's a great shortage of oncologists, interventional cardiologists, lack of knowledge and technology in order to address those huge disease burdens, we're partnering with regional groups, for example, in India, and there are leading cancer and heart and gastroenterology groups, some of which are of global repute, and creating doctor partnerships where we're either sending doctors, nurses, and technicians from Southeast Asia to India to develop new skills, to understand new models of providing large volumes of care at affordable prices, but to the very highest of quality. And that's really the challenge that is faced in places like Vietnam and Indonesia. So through the power of those partnerships, we're able to bring in new capabilities of care, to provide access to greater specialty care in parts of Southeast Asia, where previously, frankly, and tragically, if you have heart or cancer disease, your outlook is not very good. But, we're helping to try and change that in a small way.
So maybe to bridge from that, right, and taking the point of innovative treatments that become available, the collaboration on the R&D side is also of critical importance, but that comes with a very different risk-reward profile. And in the absence of a harmonized regulatory system in Asia, and also in the absence of actually a mature and somewhat uniform universal healthcare system, very often what actually happens is that new treatments get deprioritized, right, for rollout in Asia. I think we saw one good example where that was actually shortcut recently, and that was when the antivirals followed the vaccines and came to the market in Asia almost as quickly as they ended up in Europe and in Asia. Giles, can you elaborate a bit more on that partnership and how that actually unfolded?
Yeah, absolutely. And that's a really good example of how partnerships and collaborations really worked effectively to kind of address these accessibility to antivirals. And obviously the vaccines are an important part of it, but the actual treatment once you have COVID is very important. So yeah, the HPP really helped provide a platform whereby they would work with sophisticated pharma manufacturers to allow them to license their antiviral drugs with generic manufacturers in the region. I think they have done that now about 58 times. So that allows the technology to kind of and to give them these manufacturers the licensing to develop these drugs at a much lower cost base, and then provide them into the markets in the kind of lower to middle income markets at a much lower price point, which is then affordable to the local market and allows them to have access. And so that's a good example, and even underpinning that, they've taken it steps further where they've been providing training and developing hubs with the WHO in Korea, which is a really good initiative. Donor funds have come in to help kickstart these type of projects as well. So there's various different stakeholders who are involved in this, from government to donors, to kind of big pharma, to generic manufacturers, who are all kind of understand the need and the importance of this type of this partnership. So that's a really good example.
And Ada, being from the industry, how important is it to have a harmonized regulatory framework, and how to what extent would that actually facilitate faster launches of new therapies?
I think harmonization is very important. Many people have done that. From an industry's perspective, it's hard to see how to move the needle, to be very honest. Many organizations, from academia, from government perspective. If I just take Southeast Asia as an example, I think some countries, the launch of new medicine or vaccines, it takes about 3 to 5 years later, even compared to the neighbor countries. I think there are many reasons, not just from technology perspective. It's a shortage of manpower. It can be from expertise. Sometimes they favor the local manufacturer. And the other main reason is they ask for local clinical data. I think all these factors contribute to very slow to adapt innovative medicine and vaccines. I think at the end of the day, if the government, they don't realize that it's a big issue, it's the patient themselves, they suffered negative impact because they'll be slower to have access all this innovation. I think that's why I answered your question in a long way. Very important. We all work together with academic government. Hopefully one day, sooner than later, it will make it work.
We'll keep our fingers crossed. My fear is it'll take a few years to get there, but hopefully governments will also start seeing the benefit and collaborate more on this subject. So Ewan, maybe not directly related to pharma R&D, but definitely to innovation, right? Quadria also invests quite a bit in new routes to market, in telehealth, in home healthcare, e-diagnostics. How has that helped improve access? Or how do you see that help improve access, especially in countries like India, right, where very simply a lot of people live quite far away from the available infrastructure?
That's absolutely right. And, technology-backed businesses, are critical to help overcome those challenges. And, again, some data points for context. I mean, in Asia, it's estimated that there's an annual underspend of some $60 billion. Even if you had the money, there wouldn't be enough time to actually build the infrastructure to address the need today. So there have to be new models to accelerate access. And you mentioned a couple of examples of businesses that are trying to do this in India. And there's a couple of businesses that I'll mention in terms of home healthcare. There's a business called Healthcare at Home, which does what it says on the tin, if you will. But they see the problem differently. So whilst there is a massive shortage of hospital beds across India, and particularly in some of the tier 2 cities and beyond, they argue that actually the beds already exist. They simply exist in people's homes. And so they have developed a business model where they're able to provide sort of step down ICU standard care in the comfort of people's homes, which achieves a number of things. Number one, it decants volumes out of the overstretched hospitals so they can focus on more acute patients. The cost to the patient is about 40 to 50% cheaper, and we've also shown that the clinical outcomes are much better. So I think that's a really good example of innovative models of providing access to care, better outcomes at cheaper prices. I mean, that's really a great outcome for all stakeholders. Another example, and of course everyone has heard about telemedicine. So not a telemedicine business, but one that incorporates elements of it is a platform called MediBuddy. in India. And again, their response to the lack of primary clinics, particularly in some of the tier 2 cities and beyond, is that, well, everyone has a smartphone. And so we already have a network of primary clinics. They're not bricks and mortar, but they're sitting in the palm of your hand. And so their business is focused on the enormous population of small to medium sized corporates in India that are trying to provide access to preventative care to their employees. So they have an online platform that helps manage those employee benefits for those companies, right the way from corporate health and wellness programs to try and make sure that people don't get sick in the first place. Big focus on preventative, as well in providing access to teleconsultations, medicines, and diagnostics. So I think two good examples of how technology is enabling business models to provide accelerated access in new channels, outside of hospitals, outside of clinics.
Is it a fair expectation, Ewan, that actually certain countries that now maybe slightly lower on the scale of development will actually leapfrog other geographies?
I think so. I think so. I think you're seeing that, all across Southeast Asia. You're seeing that in India. I would argue there may be sort of 5 years ahead or so of Southeast Asia, but you're seeing emerging solutions in places like Indonesia and Vietnam, Malaysia, in the Philippines. Everyone is trying to, because as I mentioned, everyone recognizes that even if they have the money, just trying to build more and more hospital beds, more and more clinics, is not necessarily the best way to address the need. It'll obviously you need the hospitals, you do need the physical clinics, but there are faster ways to get access to care, and these new business models, I think you'll only see continue to grow and proliferate across the region.
Side question: is IFC also investing in such, let's say, more risky and newer endeavors?
Yes, we do, and we do it multiple ways. We have a kind of a venture capital arm, so we invest in these kind of early stage technology businesses that we really like, especially in healthcare for all the reasons that Ewan mentioned. We actually, if they're, because IFC, the way that we work, we tend to invest in larger businesses in emerging markets, so the impact has to be significant for us. So if some of these businesses that are in startup phase are too small, then we actually invest in funds, and in fact, Quadria is one of IFC's an LP in Quadria. So we know Quadria very well, and our kind of vision is very much aligned around providing kind of impact investment. So we do. The challenges, the risk profiles of some of these businesses are quite difficult for IFC, but we feel that there are definitely they're an important part to play, and they need support to grow. I think especially when you're looking at Series A, Series B, those type of technology businesses need support, so we are focused in that area.
Now, when we discuss partnerships, right, to improve access and equity, typically bucket them very high level, public sector, private sector, institutions. But it's probably worth to go a little bit more granular, right, and look at the players that actually fall within those buckets. Ada, how do you see the pharmacy channel and the role that the pharmacy channel is playing now in certain markets, which I think is really dispensing focused, right? Really transaction focused, what they could actually do.
But if I take a step back, we mentioned about a lot of the technology. I think one big thing that the healthcare system or healthcare ecosystem can do better is in terms of resources. And many countries has complained that the lacking of resources in terms of manpower, number of doctors, number of nurses, and I think COVID-19 pandemic just make it worse. And how to leverage on pharmacy channel? I think many countries in this part of the world, they can do much better. They can do the prevention part. They can treat the minor illness. and you help to reallocate the resources from hospital, clinic, to treat more serious illness and move to the pharmacy. I think that is the best way, one of the good way to have better allocation of resources rather than just keep asking for more. If I take pharmacy-based immunization as example, it's very common practice in the States, many countries in Europe. Closer to this region is Australia. They did fantastic in terms of pharmacy-based immunization. Unfortunately, in this part of the world, Philippines is the only one. We just recently implemented pharmacy-based immunization. And how to make it better in this part of the world, how to leverage pharmacy channel. I think so much things we can do more in terms of the better resources allocation. And when it comes to pharmacy channel, it's not just changing regulation, it's the whole healthcare ecosystem in terms of education, in terms of awareness, even in terms of confidence, how to make public they trust pharmacy to go there rather than just go to clinic and hospital all the time.
I think you make a good point there. I think when you're looking at it, you have to utilize all the healthcare resources available. And it goes to Ewan's point. There's a shortage of funding, but even if that funding was available and you built the infrastructure, there's a significant shortage of human resources, nurses, doctors, specialists. So how do you overcome that? I think using technology and leveraging the kind of the services out there already available, especially in the community, is a big consideration that should be looked at.
Ewan, how do you experience that when it comes to human resources, right, and required in your portfolio companies, hospitals, and so on?
Yeah, it's you know it's a really big challenge. But you know, to Giles's point, you know, use the resources that are available to you right now. So, you know, and I mentioned, I'll sort of build on the example earlier. You know, in Vietnam, there, you know, the number of linear accelerators, you know, to provide radiation oncology is, you know, very, very few, and most of them are fully depreciated. You know, not sure whether some should still be operating or not. So, you know, chronic underinvestment in technology. You know, the oncologists who, you know, have not been, you know, trained to the highest degree, or had the opportunity perhaps to be, you know, trained in super specialization compared to other parts of the world. And then the sort of that also applies to the technicians, to the nurses. And so how do you address that? Well, you know, we look within the region, as opposed to going farther afield to develop markets. We like to stay in the region to try and find resources that can help us. Why do we stay in the region? Because you know, the challenges of providing healthcare across Southeast Asia and India, in our view, are quite similar, you know, and very different to developed markets. You know, in our part of the world, it's, you know, lack of technology, lack of infrastructure, lack of specialists, and also in the private sector, you know, most people are paying out of pocket because insurance penetration is still, you know, very, very low in emerging Asia. So very price sensitive markets, you know, mass markets. So how are you able to provide, you know, high quality specialized care to the masses at affordable prices? So there are groups that we know around the region who've been very successful at doing that. There's a large cancer group in India, for example, called HCG, which has really pioneered providing cutting edge cancer care to the masses at affordable prices. Well, you know, hey, that's exactly the problem we're trying to solve in Vietnam. So, you know, we created that partnership, and we've had, you know, nuclear physicists, we've had oncologists, we've had technicians, nurses, you know, going backwards and forwards and learning how to do this successfully. And then, you know, that's culminated in our group in Vietnam being able to open up a specialized cancer center that can provide very high quality cancer care isn't available anywhere else in the country, that hasn't been available before, but most importantly, at affordable prices. And so, that's an example of using the power of partnership. We're using healthcare resources within the region to help advance standards of care, in another part. So from India to Vietnam, and we've done this from India into Indonesia, and so on and so forth. And I think that's how you address some of these challenges in the near term. It requires greater collaboration, greater partnership, knowledge sharing of resources, and I think that's really a key for success here.
So a follow-up question, right? Because you highlight the importance of affordability. So in terms of collaboration with the payers, as long as it's not out of pocket, right? Insurance companies, for example, how do you see that evolve? Is there an opportunity for closer collaboration between hospitals, hospital groups, insurance providers, and potentially also manufacturers?
Yeah, look, I absolutely think so. The insurance market is small, but growing, and is a massive opportunity. I mean, just look at the sheer size of the population in this part of the world. You look at the size of the growing middle classes, which is large, very fast growing. I think this part of the world will account for more than 40% of the middle classes very soon. And there never has been a time, I think, than recent times when people are most focused on health and prevention. And so I think there's a great opportunity to develop products with the insurers that are more bespoke to the needs of the population in this part of the world. And I think that extends beyond just providing services, but as you mentioned, with the manufacturers, working in Asia, you have tremendous science and technology capabilities, whether that's in the pharma manufacturing side, whether that's in the medical device manufacturing side. Asia can do a lot of the really complicated science and manufacturing, so you can do the hard bit. So is there a way to work with the payers to leverage that capability and technology and start designing high quality, low cost implants, for example, orthopedic implants, which are specifically designed for low cost markets like Asia. And if we start proliferating those medical devices, and solutions to patients through the hospital networks, with the support of the insurance company. So I think there's tremendous scope to get all these stakeholders working together in a way that is positive for all of them.
A great answer. Giles, IFC provides investment and advisory services, right? So, and you do that also with an eye to build capability, right? And to build capacity. What are the players or types of players that IFC is actually zooming in on to help strengthen in this region?
Yeah, so good question. So there's multiple ways that we look at this, but we do a lot of capacity building, as you're saying. So where we see a lot of opportunity is cross-border investment. So bringing in quality healthcare businesses across their subsectors, from healthcare providers to life science businesses to medtech, bringing them into the more middle income to low income markets. And the way that IFC can position ourselves is, and how we help facilitate that is to provide some kind of advisory work with these companies in the likes of Japan, China, Korea, don't know the markets as well, in the emerging markets, so we can support them in that whole business planning phase, feasibility studies, networking and meeting key players in those countries. So that's an important part to give them greater comfort when they're coming across. But also we provide financing which we have the whole suite, so it can be debt or equity or anything in between, but we're kind of long-term financing. So some of these investments take longer to get a return, so we can provide the right financing product to meet their business requirements. And then lastly, around this partnership, we can provide access through our World Bank colleagues to government agencies and decision makers, and that's important. That you need to understand the regulatory environment in detail, but you also need to meet the key decision makers early in your stage as you're developing the projects, so you can reduce that kind of friction between the public and private sector and help that kind of foreign direct investment to be much smoother. So we kind of work with the government on that side, the private sector coming into the markets, and then the local players. So we see that as a big trend, and especially I think we've seen that kind of, we call it south-south investment trend speeding up since COVID. I think there's a lot of opportunity in these emerging markets as they grow. So that's definitely a trend that we're trying to encourage.
Now, we've spoken about various players, right, in the ecosystem. We've not spoken about arguably the most important, patients, right? So what is the role that patient associations can play in making healthcare more accessible and in particular innovations, right?
Yeah, I totally agree with you. Patients should be the center of conversation. You have industry, you have big pharma, you have insurance company or capital financer. But patient, at the end of the day, they know the best is about the pathway to diagnosis, the access to treatment. That's why I think patient associations can play a very important role in terms of disease awareness, in terms of education, to many cases in terms of access to treatment as well. I think Taiwan is a very good example in terms of patient associations engagement. Taiwan government makes sure that patient associations have a regular and official seat on the table when it comes to all these treatment consultations. And I think that is a great model for the rest of this part of the world to learn how to engage patient association in a more effective way as well.
Okay. Giles, you work a lot with public and private stakeholders, right? What is the role that IFC plays there to alleviate, I guess, some of the tensions or sometimes diverging interests and objectives? Yeah,
so we help the kind of interface with the private and public sector. So as I mentioned earlier, when companies are looking to grow their businesses, we can help facilitate those conversations, understand the regulations. We also work very closely with our World Bank colleagues to identify those regulations which need to be refined to kind of unblock greater investment as well. So we have extensive dialogue with governments to try and help improve their investment environment and de-risk businesses. We also have health PPPs are definitely becoming more and more popular in governments and emerging markets. Social infrastructure is a priority. So we have a health PPP advisory team to help structure those type of projects, and then bring in the private sector as a counterparty. So there's multiple ways that we really engage with both the public and private sector.
And Ewan, I think this might be the last question before we move to the Q&A. How do you see PE firms and also VC firms potentially create a much more R&D or innovation-focused ecosystem in Asia, right? Because when you compare how things work here in Singapore versus the US, obviously there's a world of difference here, right? And very often we implement what gets figured out on the other side of the pond. How do you see that ecosystem develop, and how can you and VC firms contribute to that?
Yeah, that's great question, and a couple of observations to start with. I think the depth of private equity and venture capital, is obviously very different, particularly in Southeast Asia compared to the US. But that is changing rapidly. So I think there are more funds coming into the market. The existing funds continue to raise, greater amounts of capital, and that is only a good thing from an investment ecosystem perspective, because there's more capital available to fund more innovation. So I think that's a positive. I think a second observation would be, to your point about, it seems that there's a lot that sort of, migrates over to developed markets like the US. That sort of links back to the some of the discussion earlier about the role of insurance. If you're developing a new technology, a new product, there's kind of some fundamental questions, which is, are you making something that people need or want? And second question is, who is going to pay for it? If you've got something that's useful and that is in demand, great. But to the second question, oftentimes it's the large reimbursed markets where these things can be sold. And so naturally, as a consequence, you see a lot of good technology innovation, popping up in places like Singapore, but the market for it, unfortunately, is fortunately or unfortunately, depending on perspective, is over in markets like the US, where the reimbursement is there. So again, private equity and venture capital has a role to help fund and develop and incubate these technologies and companies, but there is also a need to work with the payers to make sure that these products and services can succeed within Asia. And there is evidence of that happening. But my sort of frustration is that oftentimes a lot of the innovation is developed here, but with an eye to markets like the US. It'd be great to be able to. Apologies. I hope you can hear me. Minor technical, and my ear literally fell out. What I hope that we can back as an investor, are more innovative companies that are really trying to set themselves up as Asia for Asia champions, and that would be a really positive thing for the region. But it requires collaboration between the founders, the companies, the payers, and the investors. But watch this space. I think it's a positive trend that will continue to grow in the coming years.
We're running out of time. Maybe one last quick question, which I think is quite interesting from the audience. And maybe Ada, you want to answer this. Do the panelists think that there should be more investment put into medical tourism to improve access to treatments overseas?
The short answer is yes. I think it answers the question or address concern in terms of resources allocation. If I use ASEAN as example, if different countries within ASEAN, they can become a specialist. Like one is oncology, one is diabetes, or one different therapeutic area. It can be a great way to do the medical tourism to maximize the resources.
Great. I think we've reached the end of the session. Thank you very much to my panelists for the great answers provided. Thank you for a very good dialogue, and good luck with the remainder of the seminar. Thank you.